Greetings, this is Advocates Global News, and we will be presenting global news in the viewpoint of advocates for various things across the world. Today we're going to focus on coronavirus, which is recently renamed to COVID-19. And this is for today, 2/21/2020. And what we're going to discuss is what today's coronavirus numbers tell us. So first we'll take a look at the Baidu charts. This is a site that I'll put the link below in the YouTube description. But Baidu is a Chinese Google site, and they have various information listed here. Now I need to talk a little bit about these numbers because they changed very recently. The top number on the left is confirmed diagnosis. So this is what they were using all along since sometime in January. And confirmed diagnosis meant that if you had the symptoms and you wanted to go into a hospital and get tested to see if you have this coronavirus, the new one, they would have to draw your blood and look at your blood under a microscope. And of course a virus is not only microscopic, it requires an electron microscope because millions of these little viruses can fit on a human cell, depending on how big the human cell is, but they're very small. So this test took a while, and since about a week ago, China introduced another type of test which is based on a CT scan, which in that scan what they're looking for is coronavirus type effects that it has on the human body. So they'll take a look at your lungs and see if it looks, if your pneumonia looks like coronavirus. So that's a cumulative diagnosis, and that number includes the confirmed diagnosis from blood tests to the scan diagnosis. So that gives you the total number of cases in China, which is right now today at 75,571. Also, we have suspected cases, 5,206, and that number is down drastically. So there's, some of a week ago or a couple weeks ago, that number was way up there into the tens of thousands. But it's gone down now because either people come down with coronavirus and they get tested to confirm it, or they get tested to confirm that they don't have it. So that number is dropping now. And then you have cumulative cure, which is a number of people cured so far in mainland China. So if you really wanted to take a look at the people that had coronavirus right now, it would be 75,571 minus the 18,000. And then the existing severe is something that I've got a couple explanations for, and I don't know which one to believe, but let's just assume that existing severe now means that you're a patient who's on a respirator. So you have probably pneumonia, your lungs are filling with fluid, you can't breathe by yourself, and you have something draining your lungs, and then you have something breathing for you. So that's existing severe. That's up to 11,633. Now that seems like a big number, but a lot of Americans have heard the CDC coming out and saying, why are we so concerned about coronavirus? We only have 16 cases and 10,000 people in the United States died of the flu this year. It's been a bad flu season. And the reason people die of the flu is because, it's the fifth or sixth, depending on who you believe, fifth or sixth largest killer in the United States, behind, strokes and cancer and, accidental deaths and stuff like that. So number 5, if you're going by Johns Hopkins, the 5th leading cause of death is pneumonia due to flu. And that would be, when you're talking about some of the largest causes of death in the United States, you're going to get into the tens of thousands. So this number isn't that big because this is China. If we have 10,000 people dying of the flu, it's not unreasonable to think that China has, 50,000 people dying of the flu every year. So right now, existing severe cases, 11,633. And then we have, so far in mainland China, 2,239 deaths. And also down below, you can see a line that says, change data yesterday to be updated after the announcement of the National Health Commission. Now, depending on what time of the day you get into this Baidu link and take a look at this data, these numbers here could have another number to the right saying, plus 1,800 cases for today, or, minus 600 cases. So there'll be two numbers instead of one under each heading here. But they have to get together. The National Health Commission decides what that number is, and they publish it once a day. And you almost have to be lucky to see that number, because then they reset for the next day. If you scroll down this main page, you'll see the map of China and the various provinces in China and the number of cases, in Hubei province in the middle here, which is where Wuhan is, which is the epicenter. That's in white, but kind of could be in black. Just they made it white because the numbers wouldn't show up, or the province name wouldn't show up. And then on the right, this shows you all of China, and then China's dream South Islands in the South Pacific are included in here, because everybody knows that China was a seafaring country, just like Spain and Portugal and England. They went around discovering all kinds of things. That's why China claims the South China Sea. Bad name for that part of the Pacific Ocean. But anyways, they included that in their graph. Just I've never seen it included on anything official before, but this coronavirus thing, they have the South China Sea plotted there too. Crazy. So if you scroll down the main page, right underneath that map, you'll see the first graph, and the first graph plots added suspected cases and new diagnoses for today. So today there's 892 new ones, and that's actually on 220. So 892 would be the difference between 220 and 219, which is a dot in between the two. And, like I said, the day before, that was under 400 for the first time since, way back in January. And that large spike that you see there comes from the addition of 15,000 cases in one day when they changed and, came up with a new criteria for diagnosing cases. Not only blood work under a microscope, but the scanning work too. So that's why you see that huge spike there. And then the next day on the downward slope, if you can see, there's a little dot there. And that's also an aberration compared to what was happening before. And I think that's because other provinces adopted the same criteria. And then, these graphs have been up and down every day. They're kind of not as good looking as, they just don't do as good a job of explaining the situation as the Johns Hopkins data, which we'll take a look at next. So this is, I don't know why Africa is up here in the title. I think that's a translation issue. New confirmed cases nationwide, Hubei, and the rest of China. So, like I said, I don't know where Africa comes from. So as you can see on the right side of this graph, there was a dip, yesterday in all three, of these, and this is in Chinese. But the red line is, all of China. The pink line is Hubei province, including Wuhan, the city. And then the gold is suspected cases. So there was a big dip yesterday, and as I said, that was kind of an aberration downward from what we're used to seeing, because it was under 400 cases for the first time. Now, this is Johns Hopkins, and they plot their own kind of stuff. So you can see on the left, the total number of confirmed here is throughout the world. So there's 76,727 cases confirmed in the world right now. 75,467 is from mainland China. So that's down about 100 from what the Baidu thing just said. So that 76,727 should go up 100, because Johns Hopkins is a little bit behind the Baidu data, because that's where they get their data, is from wherever Baidu gets it, from that health organization. So you can see on the left there's a list of different countries or areas, and on the right you can see total deaths, 2,247 deaths, 18,562 have recovered in the world right now. And on the bottom right is a graph that we'll take a look at in a little bit enlarged version in a couple minutes. So like I said, the first thing you want to look at here is the mainland China number, and you want to compare it with Baidu, because that'll tell you what the real confirmed would be. And like I said, right now we're behind about 100. This others is basically cruise ships. It did say whatever princess that cruise ship is in Japan, and then it went back to others. It was others, and then it was the name of that princess cruise ship, Japanese cruise ship, and now it's back to others because there is another cruise ship involved now, but I think it only has one confirmed person on it. But anyways, they're kind of throwing numbers here under others, and those are actually people of different nationalities that haven't been sorted out yet. Or they probably have now, but they're still lumping it under others until those people are repatriated back to their own country. So you can see here 70 more cases on Japan cruise ship, and this is a few days behind. But this is it's the Diamond Princess, the name of this cruise ship, and I'm sure everybody's heard of that, because there's a lot of cases for one ship. And also on the bottom here, if you take a look at the number of U.S. cases at 16 right now, we picked up another one in California, and then the one previous to that, 15th case, was in Texas. So we'll take a look at the U.S. numbers in a little bit. But there was an announcement yesterday or the day before from the Los Angeles Times where the coronavirus cruise ship passengers are going to be brought back to the United States. Now, all cruise ship passengers are going to fly back to the United States. Those who are not diagnosed, who still could have the virus, are going to be transported back to the United States in somewhere in the Los Angeles area. Now, there are 45 Americans that have been confirmed, or 44. I'm not sure which number to believe. And that'll give the United States over 60 cases altogether. So you're going to look at a big jump from the U.S. down there with 16 cases right now, and that third yellow arrow. That's going to jump way up to over Thailand and right below Hong Kong, probably. In the next sometime this weekend, when the United States brings back our citizens, that number is going to fly up there, and then 634 others will be reduced by the number of people being taken back by the United States and in several other countries. Australia is doing it this weekend too. Now, normally, if you click on the U.S. down there, you see a map of the United States, but the map's not showing up right now for some reason. A little glitch here in the Johns Hopkins something or the other, whatever makes a map show up. But normally you would see the United States, and what you see right now, that blue dot is the Seattle person, the first person in the United States to have coronavirus. And then you see those red dots down along the West Coast. Those are all California. Then we have one in Arizona. And then you have a dot in the middle that's Texas. And then you have two. One is Chicago, and then one is Wisconsin, University of Wisconsin student. And then you see two up there. Those are Canadian. One of them is Toronto, and then the one down to the left a little bit is London, Ontario, which is basically across Lake Erie from northeast Ohio, from the Cleveland area. And then on the far right you have Boston, which was another early case. So normally when you click on US, you'll see the map and you'll see the states, but it's just not showing up right now. A little glitch. And also we have only one person recovered. No, over on the right we have, oh, that's because I marked Seattle. On the right, there's a total of 5 recovered now. 2 in Chicago, so those people aren't there anymore. 1 in San Diego, 1 in Santa Clara, and 1 in Seattle. So, the rest of the cities still have people in the hospital. So another thing that I have marked here is South Korea, which is kind of alarming if you've been following this. South Korea was not anywhere near the top of the list before, and now all of a sudden they are, which is something that's just popped up in the news yesterday. And the cause for that is this super spreader in South Korea. Now, I don't know, I've read a few articles about this. Some people say a church, and some people say that it's a commune, and whatever it is, it's church related, and one person has infected more than 40 other people now. So that's why that number for South Korea, it basically doubled overnight. In the middle screen here shows a guy from Time, did an interview of him, and he's speaking in Korean, but there's, you can read the closed caption in English. And he's talking about, the issue. Right now they have basically one city that's a hot zone now in Korea. Daegu is the name of the city, and it's basically in lockdown, just like Wuhan is. Nobody outside. They've got that whole city blocked off right now because of all the cases that popped up overnight in that one city. And if you want to see where Daegu is in Korea, there's where it is, South Korea. So it's not a port city. It's kind of a strange place to have a big outbreak. And not due to a fish market or anything like that, due to somebody traveling and infecting everybody else. Super spreader. It's a couple times we've heard that term now, super spreader. One person in the UK was considered a super spreader, but I don't think too many of the people were diagnosed, had cases that were confirmed. Then we have Singapore, and the reason I had that highlighted to talk about was because Singapore has 85 cases, and that's crazy for Singapore. I mean, the World Health Organization came out and said, China's doing a pretty good job, and the reason we're calling this a global issue is because we're afraid of the other countries that don't have good health care. Well, Singapore is not one of those countries. Singapore is a city-state, and it's a pretty advanced society. So it's strange that such a small place has such a high number, and that's something that a little bit concerning, something to keep an eye out. Now, Hong Kong also has a bunch of cases, 68. In Hong Kong, I think you can imagine people from Wuhan, they said that right after, before the holidays, before the Chinese New Year, where they just kind of said Wuhan people should stay home, but they didn't block the roads or the trains. They did close the airports, but up to 5 million people got out of Wuhan. So you can imagine where they went. I mean, a lot of them go back home to their mothers and fathers, some little rural village somewhere in China, or a lot of people just took off to Hong Kong, and Macau and other fun places to be. In Singapore, no doubt. So here's, I clicked on Singapore to show you, and again, the map for Singapore didn't show up because the maps just aren't showing up right now except for mainland China. It's probably fixed now, but I took these screenshots an hour ago. So right now Singapore has 85 cases and 37 are recovered. So they're doing okay, and probably they've got things under control. And I just put a map in here in case people don't know where Singapore is. It's basically on the down south of Thailand and the Malaysian peninsula. And it's a city-state, and if you look at the map on the right, it's just a pretty small area, a real small area to have 85 cases. Then I just wanted to mention, the WHO has concerns about countries that don't have very good health care. And, the crazy guy from North Korea, came out the other day and said, if we ever get a case here, we're in big trouble. And that's true because they don't have the medical facilities of South Korea, and that could wipe out the entire population of North Korea. So, but they don't have a case yet, which is good or bad, depending on how you look at it. But, Thailand wouldn't be one of those countries, Malaysia, Vietnam, where maybe the healthcare systems aren't deemed to be up to speed. There's other countries too, Indonesia, where it's not just always the state of the healthcare system. It's something to do with the healthcare system and the population. If you take a look at Indonesia, that's the third largest populated country on the planet, behind China and India, and then the United States is fourth. So Indonesia is a huge population, and you just don't want to see too many cases popping up there because they're probably ill-equipped to handle a lot of cases. Such a densely populated area on the island of on Jakarta and in the city of Jakarta. Oh, and this little map on the lower, or graph on the lower right, you can't see it. It didn't show up in the screen print, but there's a little icon that you can click on there to expand that graph, and that's what we're going to see on the next page. So you can see I put a red line here, what things look like back from January 26th through the end of January, basically. And at that point, you had a steady number of increasing cases popping up every day. It was linear, if you take a look at that. And then you had another period where it started accelerating a little bit. And it's first it actually started accelerating, and then it started turning down a little bit. And then if you go all the way up through like February 10th, the trend there, or 11th, the trend was just an increasing arithmetically, and the line, the linear, you can see it's a little steeper than the first line. And then you had that huge aberration, which I didn't try to graph, and then the other aberration the next day. And then we ended up with a line that was just slightly, not as steep as the last bunch of days. And then for the last few days, it looks like it's leveling off. And that's what you see here. So right now it looks like, we're increasing every day the number of cases, and I couldn't tell you the increase in the number of cases because China, only publishes that for, maybe 3 or 4 hours every day when the day is over China time. And then you have to grab it before morning because it's reset to 0 again. So, but it does show up on the graphs if you happen to miss it. And, right now we're looking at a, linear increase every day, and it looks like things are tapering off. When you consider all four of these red lines where, first it was not very steep, and then a pretty alarming period of over a week where it was drastically increasing, and then it started tapering off again, and now it's tapering off even more. And these are some pictures that I grabbed from the internet where this is what's happening in Wuhan right now. It's, the government of China, they basically took over the city. They put other people in the city. I think somebody sent me a message. I have a pretty extensive Chinese contact network, and somebody sent me a message and said that the mayor of Shanghai was now promoted to be the governor of Hubei province, which includes Wuhan. And they basically took the other people out because, when that Dr. Lee, when he tried to, inform people that we have a new virus and we should be concerned because there's a bunch of dead people popping up, and that's when they identified that fish market in Wuhan as the epicenter of this whole thing. So, at that time, they weren't doing things very well. And the government basically, replaced some of the management people in the city. So, and they also mandated a bunch of things. And we'll take a look at that in a minute or two. But right now, you can see these pictures showed up in the last couple days on the internet, where basically they're disinfecting the whole city of Wuhan now. So you have guys going down the streets with these, looks like a leaf blower, kind of in the middle picture, and the picture on the right is a truck with something that looks like a leaf blower. And these are videos, so you can find them on the internet and take a look at them. And then the upper left photo is a truck going by with a big, bunch of disinfectant coming off of the back of it. But you can see, Wuhan, the entire city, not only is it a ghost town, now it's being fumigated. So this is pretty drastic. I can't see this working really in another country. China, they might have lagged behind in the first few days and not admitted that they had a problem. But, then they started bringing in the army. All of the medical people in the army basically are in Hubei province or Wuhan right now. And they weren't very well trained or outfitted, and that's why we have 17,000, health workers in China that are confirmed cases right now. But they're getting better as time goes on. So, and then you can see on the lower left something that looks like a fire truck, or, shooting out a big. I don't know why that guy's driving behind there. I think I would pass that truck really fast. But anyways, the entire city now is getting disinfected, and it's just a haze over the entire city now. So they're really taking this seriously. And I thought I would throw in some of this stuff. These are just personal contacts of mine that I just thought I would throw them in there to show a little bit about what people think. One person on the lower left there, the age of Noah's Ark, they went out wearing 2 masks today. And then the one in the middle is just, all of these people are stuck at home in their homes, in high rises. And they basically stay inside all day, the whole family. And, this person here is talking about cooking breakfast every morning now, which is something she didn't normally do. And on the right, you have a person that's just saying, come on, guys, come on, China, pray for China. Obviously, this girl is Christian. But these are just various comments I thought I'd throw in there to give it a little bit of a personal touch, and you can see what people are going through a little bit. On the left, I got caught. This is pretty funny. I got caught having a barbecue, and I'm not allowed to have a party now. So I'm going back to my sister's house for dinner. I asked her if she went out for Valentine's Day. This is just yesterday. I think I asked her that. And she got caught having a little gathering in her place because you're not allowed to have any kind of gathering in your place. They're trying to keep people from gathering and getting together. Then the middle one is, some town, Ganggu County First Medical Aid Team headed to Hubei province. A whole team of people there. Hopefully they'll be protected pretty well, but it looks like they're getting some medical people that aren't army people now to go in from other areas of China that don't need, all of their medical people. So wherever this is, Ganggu County, I'd have to look up where that girl lives. And, they're sending in a pretty good sized team of people. Looks like, 60 people or so in that picture. And then on the right, somebody just, I wanted to wear an earring today, even though people are stuck inside, hey, dress up, put on makeup today, just for a change in the routine. And I thought that was kind of humorous. And she's, taking what's left of her flowers and putting them in some little swans and putting them around the house because she doesn't want to waste the last of her flowers. Then on the left, I have another contact says, I think I'm going to be cooped up in my house. Then in the middle, this is from Beijing. And this girl she's an MBA from the University of Hong Kong. I didn't know she was back in Beijing. But it says, I'm staying at home now with my family, and one family can only have one person going outside shopping every 2 days. That's in Beijing. So that's like the law of the land in Beijing now. I know a few other people in Beijing, and I'm going to have to talk to them about it. But one family member every 2 days can leave their home and go out in the world. And even then, no matter where you are in China, if the streets, all the cities look like a ghost town. There's nobody out on the streets or the highways. There's nobody working. There's no kids in school. And if you go to a grocery store, they're going to have a big sign out front that says, you have to wear a mask to get in. You have to have your temperature scanned also. So this is like a big police state going on right now. And, I don't know if that would fly in every other country. So, we could be grateful that China's really going through some, extreme measures here. And then on the bottom, she says, but no one's walking around, telling people to stay at home. Well, there was in that little video that I sent her, a 13 second clip of this guy. He says, first in Mandarin, and then in the second language is either Cantonese or maybe this is Shanghai and it's Shanghainese or something like that. I don't understand anything in the second phrase. And then the third one is in English, and it says, stay home, wear a mask, no party. So he's telling people that, you're not allowed to have parties. You're not allowed to have your relatives over. You just stay inside with your family, And then on the right, let's see, yes, now stop any activities. We're not at work. There are some places to remind people not to go out. So in other words, wherever you go, there's going to be big signs that say, stay inside, but you do have to go out for food. Luckily, I've spent a lot of time in China, and, going out for food usually means just going down to the bottom floor of your condo, your high rise, and the bottom floor is going to have, a big fruit stand and, one with fish and meat, and, basically means just going down to the bottom floor, and you have to go outside and go around the perimeter of the building and buy your the groceries come in every day, and there's really no shortages that I've heard of, despite what you heard in the news for the first few days. There's just so many places where you can buy food, and the food is being replenished. There's a shortage on masks now and hand sanitizer, but other than that, you're pretty safe. And this person on the right, just asked her, are you socializing? I guess because this was, maybe yesterday. Yes, now stop any activities. We're not at work. There are some places to remind people not to go out. So this person on the left, it just noticed something. Apparently this, I don't know who this is. I've got her blocked off so good I don't know who it is. But it's, one of my friends in China. No need to shuttle. You can learn at home easily online children's art classes. So only 200 seats per day. So she's encouraging her own. This is WeChat, which is like our Facebook, like our chat section of our Facebook. And she's just, telling people, hey, you can get your kids to take an online art class, and that gives them something to do. And then another girl, I asked if she went out on Valentine's Day. I'm not going anywhere. So most of these people are hibernating at home. And on the right, we have this guy who's got the megaphone, and I got this ready on my cell phone. So let's listen to him.
Stay home, no party, put on mask.
So come on. So he's saying, stay at home, no party, put your mask on, which it's, the guy going around with a megaphone, announcing that, to all these high-rise residential towers. So that's kind of amusing that, some people are going around announcing that. I don't know what city this is. Most of these ladies, I sent this video, I forwarded it to a lot of my contacts, maybe 20 or 30, the ones I've been keeping in contact with since this coronavirus. And none of them have seen this video before, so it's not their town. Things get around pretty fast on WeChat. When something happens, everybody in the country knows about it. Well, not quite. I mean, the thing about WeChat is there's restrictions. Nobody can have more than 500 followers. So it's like a chain reaction. It's not like one person shows you a video and there's a million people that see it, like on Facebook. The maximum people that can see it, if you show it on, if you share it, is, you're limited to 500 contacts. But anyways, things spread pretty fast in China once it makes the news. And this would have been something that should have made the news. But like I said, nobody had seen this video before. And that's all we have. So appreciate your time.